You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements to your smile can make a big difference in your life. With us, we have America's orthodontist, Dr. Anne-Marie Gorczyca. Dr. Gorczyca, welcome to the program.
I'm happy to be here.
I'm glad you finally made it. I've been asking you to come on the show for at least 2 years, right? You finally made it over, so I appreciate it. For people that don't know you, tell us a little bit about your practice. Who's your typical patient?
Well, my practice is located in Antioch, California, which is in the East Bay, about an hour from San Francisco.
Okay.
And we treat a broad range of patients, starting from age 4 with some functional shift problems in the primary dentition, baby teeth,
Okay.
all the way up to age 84.
84-year-olds
For
are
elderly
getting...
patients who have periodontal disease, periodontal problems, that can be corrected by straightening crowded teeth.
But 84-year-olds are getting...
That is correct. It's never too late for a beautiful smile.
Okay, great. Now, you've written a book for
Yes.
dentists about everything you do.
Well, it's a marketing book that describes several of the things we do at Gorczyca Orthodontics and have done over the last 25 years. And I'm hoping that it will bring some joy to some dentists out there and some dental offices, but most especially to the dental patients that we treat.
Okay, good. Now, for people just tuning in, I've seen these photos, and they are dramatic with just... And most of this was just orthodontics, right?
That is correct.
That I'm looking at. You knew you wanted to be a dentist, I guess, or an orthodontist since you were in 7th grade. I think
That's correct, Randy.
How does somebody know that at that
Okay,
age?
let me tell you a story. I used to look like this.
Okay. Oh, really?
When I was in 3rd grade, my teeth protruded profoundly, and it was because I sucked my thumb for a long time. And when I was in 3rd grade, my general dentist said I needed braces. So my general dentist actually was the first person who put braces on me. And I had my teeth straightened, but my bite still was not correct because it was only...
She had like a big overbite.
I had a big overjet in the horizontal direction.
Okay.
My front teeth were straight, but I still didn't look good. And when I was in 7th grade, a new orthodontist had moved to our community and invited me to come into his office to see what he could do for me. He changed my life. And he improved my smile, he corrected my bite, and I knew from that time I wanted to be an orthodontist. I just loved what he did, but more so, I just loved his whole office and his whole work environment. So I never changed my mind after that. I just pursued my dream, and I'm living my dream here today with you.
And you're convinced, by the way. I mean, you're changing people's lives by straightening their teeth.
Definitely.
Is that right?
Definitely.
And you call yourself, I don't want to put words in your mouth, but an orthodontic evangelist.
That's correct,
What does
Randy.
that mean to you?
Anyone I can help by straightening their teeth, improving their smile, giving them more self-esteem, I try to reach out to them. And I usually use the phrase, have you ever thought of orthodontic treatment? And many people are not even aware what an orthodontist is or what orthodontic treatment really is all about. But it's more than 6 straight front teeth. Orthodontic treatment changes your bite from an unhealthy bite to a healthy bite. It changes your face, it changes your profile, it changes your smile, and ultimately it changes your state of mind.
So let's start with this little girl. You say you had this kind of a problem.
Yes, I did, from years of thumb sucking.
Okay.
And what happens is the teeth are protruded. They start getting spaces between them, and they stick out of the mouth so they're unprotected by the lips. Look at her profile, Randy. Look at her upper lip. It's a very sharp angle. The upper lip is pushed out forward. But that can be corrected by retracting the teeth, and the lip follows the teeth in that action. And then look at the final result.
Wow.
It's awesome. She is a beautiful, beautiful young lady.
So just a few years later?
2 years later, this patient's life has been transformed.
How
She is
so?
a confident young woman out to conquer the world. Randy, let me tell you what can happen if this is not treated and the teeth are not retracted.
Okay.
Teeth can be fractured by common accidents. If a little child with protrusive teeth falls down on the sidewalk, runs into a piece of furniture, slips, falls, it can be as simple as picking up a glass. They can fracture their front tooth very easily when it's not protected. So what we did in this case was what we call phase 1 orthodontic treatment. It's orthodontic treatment on a young child, 7 to 9 years old, where we're basically fixing the front 4 teeth, putting them in the correct position, and then holding them there until years later when all the permanent teeth come in at age 12. You might be wondering, how early can these problems be corrected?
Yeah, okay.
Here's a dramatic case of a young boy who initially came into my office at age 5. He had a big discrepancy, a big change between his upper teeth and his lower teeth, a big overjet. And he had started kindergarten, and the kids were bullying him, and he didn't want to go to school.
Do you hear those stories, by the way?
All the
The
time.
parents tell you, or the kids too?
The parents and the children. And you may notice in your children, they may not tell you, but if they're quiet about school, they don't want to talk about school, or if they tell you they just don't want to go to school at all, they could be bullied at school. So this family came to me at age 5 with their son and asked, is there anything you can do to help our son with his overjet, with his problem? We said, yes, there is a solution. We will find a solution. We will correct it.
And this is at 5 years old?
At age 7, when his permanent first molars came in, we did a procedure on him, which is called an osseous distraction procedure of the lower jaw. It's a lengthening of the lower jaw.
Okay.
It was the first one done in Northern California. And basically what it is a tiny space is created in the lower jaw, a device is attached which is advanced every day until that jaw is lengthened to the correct length. The reason it's done that way, Randy, is this is a dramatic change. If you look at the initial profile to the final profile, and you're extending not only the bone, but you have to lengthen the nerve, the muscle, the soft tissue, the skin, everything that goes with it. And that has to be done at a very gradual rate. So Randy, look at the before and after side face shot.
Okay.
You can see a big difference in that lower jaw.
Yeah.
Also, look at the smile before and the smile after. You can tell in that first photo, that young man is struggling to smile. He doesn't want to smile. He's sad to smile. But in the end, he has a cheerful smile. You can see it in his eyes, and you can see that that smile comes from his heart. So we have changed his life. He's happy. He's ready to go back to school. He has lots of friends, and he's having a wonderful life.
And at what age should a parent then, and I have a 12-year-old, but at what age should they maybe get a consult? Should they see their pediatric dentist? Should they see an orthodontist?
The American Association of Orthodontists and all orthodontists recommend that every child receive an orthodontic examination by age 7. If there is a situation where in the baby teeth the jaw is shifting and there's a crossbite, anterior crossbite, posterior crossbite, shifting of the jaw, any discomfort whatsoever, the child should be brought in as early as age 4 because things can be done to fix the bite, which will enable normal growth to occur.
Okay. So when it's all done, what do the children say? Do they ever say anything?
They
or
are
is it more
so
their
thrilled.
parents?
And the little kids run up to me and give me a big hug and say, thank you, Dr. Gorczyca. I'm so happy with my teeth. This little boy ran up to me, gave me a big hug, and said, thank you, Dr. Gorczyca. You've changed my life. I'm so happy.
Really? Do a lot of kids say that?
Yes, they all say it. They're all very happy. And the adults, too, especially the adults.
Okay.
Let me show you another case.
All right, all right.
Here's a young man. He came to me when he was 16 years old, and we had proposed an orthodontic treatment plan. He decided at that time only to straighten his teeth. Not with us, he went somewhere else.
Okay.
And we always tell our patients you can always come back and do it right. So he came back at age 24, and look at the difference. This is tooth straightening alone versus comprehensive orthodontic treatment. The full...
So that's what changed this guy's profile?
That is correct. It is a full
So he had kind
analysis.
of a weak-looking chin before.
That is correct. Because orthodontics is more than 6 straight front teeth. It's the whole face.
But why is the chin coming out more? Is it an illusion? So the chin's the same place.
It is.
Help me understand that.
It is a reconstruction.
Okay.
It's part of the orthodontic analysis.
Okay. Okay.
And all of the bite, the face, the profile, all of that is taken into consideration with comprehensive orthodontic treatment. This man is a new man. He is the handsomest guy in San Francisco, California, and he is loving it. So.
Yeah, it's a beautiful smile at the end.
Yes. Now let me tell you another story.
Okay.
Have you ever been in love at first sight?
Yeah.
Did you notice the person's teeth?
I did. I did.
And what if their teeth had looked like this?
Okay, yeah.
Well, no matter what you say, when you have teeth like that, it is a personality teeth mismatch. And it's hard to fall in love at first sight with a person who
Was
has
she
crowded
self-conscious
teeth.
over this?
All people with crowded teeth are self-conscious of it. And it's a natural instinct when we want to see a beautiful smile and we don't. There's a little bit of a pullback, but that can be fixed through orthodontic treatment so that you can have love at first sight. And when someone gives you a big smile, they go, wow.
So her after.
Yes.
Very nice.
Yes, and take a look at the teeth afterwards. It's a new person.
And what does she say, by the way?
She's thrilled. She's absolutely thrilled. She's a happy teenager in high school.
Because, you know, those teenage years can be pretty tough with people making fun of you or whatever, or especially if you don't like something about yourself. It's terrible. So they don't like, because I was lucky to have, you know, my teeth were straight. But are there a lot of kids that really hate their smiles?
Well, people with crooked, crowded teeth tend not to smile as much as people with teeth that they're proud of.
Okay.
So the alignment is very important, and it definitely changes a person's personality.
Nice. Okay.
Okay. Here's another dramatic case, and this is a case of open bite. And I show this case because I want to emphasize the point that it is not possible to do every single case non-extraction. This is an example of secondary orthodontic treatment. I met this woman in the office. She brought her brother in for a retainer check. And she was sitting across the room, and I said kindly to her, have you ever thought of orthodontic treatment? And she said, I've already had orthodontic treatment. And I said, I can help you. I can fix this. But it's going to require
so open bite
extractions.
is what? Like the teeth are flared forward a little bit?
The teeth are open at rest. They do not meet. So with an open bite, with the front teeth.
So that is closed for them?
That is closed. That is fully closed. Their back teeth are touching.
Interesting.
But their front teeth cannot touch.
Okay.
It's very hard to eat a sandwich when you have a bite like that. Open bite is the telltale sign of a case where teeth should have been extracted and they were not. Okay. So we see this a lot and we correct it a lot. And that's the message I want to get out, is that we can fix open bite through orthodontic treatment.
It's a much prettier smile.
Yes, and she's a beautiful woman. This changed her life. She got a boyfriend, she got married, she started a new career, she works in marketing, and she moved to Southern California.
But you're an orthodontist. You probably think, at least it seems like, that the smile is probably the most important thing.
It is
How
very
important
important.
is the smile, in your opinion?
It is so important that it can affect who you date, who you marry, what type of job you get, and how readily you're promoted. And studies have found that.
Is that right?
Yes. So it's one of the most important things that you can fix health-wise to make a big difference on your personal life.
So adult orthodontics, are there a lot of people getting a lot of very expensive veneers? Because that's an effective treatment when you could have done the same thing with orthodontics? Like Invisalign or something else?
Yes, well, orthodontics prepares a case for veneers. And orthodontics is done in many, many veneer cases. Often the teeth can be straightened without veneers, and veneers are not necessary. None of these patients have had veneers, and their teeth look fantastic. Let me show you another case.
All right, all right.
Here's another young woman. She came in. She was the mother of one of my patients. And she sat across the room, and I looked at her and said, have you ever thought of having orthodontic treatment? And she said, I've had orthodontic treatment. Now, her teeth are straight, but her bite still is not corrected. She has an open bite, and in this case, if you look at the angle of her jaw, it's a very, very high angle of the bony structure. This needed correction. This patient thought she could not be helped. She thought this was caused by tongue thrust. But the tongue thrust...
That were pushing her front teeth out.
That were putting her front teeth out. But the tongue thrust is actually the compensation for an open bite. It is the response to an open bite.
So her mouth is closed right there. I mean,
that is correct.
She's trying to touch her teeth.
Yes, she's trying and she cannot. And this can be corrected easily with orthodontic treatment with the adjunct of some orthodontic surgery.
Okay, so the after, beautiful smile, obviously.
Yes, and she's very successful, happy, and smiling in our local community.
So as the orthodontist, you work together with a team of like
That
oral
is
surgeons
correct.
or specialists that are going to get this all done?
Yes. And let me show you another case. This is one of my favorite cases because it dramatically shows all the changes facially that can occur with orthodontic treatment. If you look at this initial face, I call this my fairy tale case because this young woman came in, she looked sad. Her cheeks were drawn, her eyes were drawn. You see the whites under her eyes. Her lips are open at rest. Her chin is puckered. And more so, she has a gummy smile. And it's a significant gummy smile, and her teeth are protruding.
She was bothered by it?
She was saddened by it. And she wanted to be happy, because in her heart, she was a happy person. So we said, we can fix this. It's going to take a little more than Botox to the upper lip, but we can fix it permanently. Look at her face. Look at her cheeks. Not only is the gummy smile gone, but it's almost like she's had a facelift. Her cheeks are so cute and puffy. She's adorable. She met her husband. She got married. She has 4 children, and she actually works as my treatment coordinator now.
Oh, she works with you now?
Yes. So any patient who has questions about orthodontic surgery or braces, she's the perfect person to describe it to them.
Now, we talked on the phone, and I think we talked, I said there's no crystal ball, but you're convinced that when you get these people, that their lives become better because of their teeth. Is it more so because of their self-esteem, or they just look better or feel better about themselves?
They look better, they feel better, they function better, and they're healthier. Your teeth are the first entrance to your health, what you eat, how healthy your periodontal health is. So it's all tied in with general dental health. Let me show you another case.
All right.
Randy, it took a team to treat this case. And in our local community, we have a Seattle Study Club. We comprehensively treatment plan our cases with diagnostic setups, and we work as a team. And for world-class dentistry, that's what it takes. So in this case, this woman had maxillofacial oral surgery for a bone augmentation, implants, orthodontics, restorative dentistry, but she looks fabulous. She is in good health and functioning fantastically well, and it changed her life.
Very nice.
The treatment made this woman look so much younger.
Yeah.
And she was so happy and so appreciative that finally she had a great bite and a great smile.
Okay.
Let me show you another case. Different topic, deep bite. What is a deep bite? Everyone thinks they have a deep bite, but deep bite, yes. Everyone who walks in the orthodontic office, they say, I have a deep bite.
Is a deep bite an overbite?
It is a vertical overlap of the upper teeth over the lower teeth. So this example illustrates that a hugely deep bite where the upper teeth are almost touching the lower gum.
What's wrong with that, by the way? Because it looks good in the before smile.
Very destructive, very destructive. And let me explain why. Over time, the teeth continue to erupt. The teeth miss each other, and they keep going down until they hit the gum. They start to push back the gum. The lower teeth hit the roof of the mouth and push back the gum. Then they start wearing away the backs of the upper front teeth. Eventually, you need crowns. And after that, you start wearing down your lower teeth.
Interesting.
So look at the before and after here. The beautiful smile before, the beautiful smile afterwards, the teeth on the lip line. The smile looks beautiful, and this is functional occlusion.
So you could see the lower teeth,
you should
whereas before you couldn't.
That is correct.
So what do you do? Can you self-examine your kids, and if they're smiling and you can't see their lower teeth?
They have a deep bite.
They need to go in.
How fast can orthodontic treatment be accomplished?
All right.
No one does orthodontic treatment faster than an orthodontist. And this next case shows that.
Okay.
This case actually took 2 months and 2 days for us to prepare those teeth for veneers. And to do that, you may be surprised. The patient actually had metal brackets with a metal wire. There is a new technology that orthodontists are offering now. It's called Excelident. This is it. This can cut your orthodontic treatment time in half, whether you're doing Invisalign, braces. This technology recruits osteoblasts, osteoclasts. It makes the rate of orthodontic tooth movement proceed twice as fast.
Okay.
And this is a scientific method that can be used to speed up your orthodontic treatment. So if you want the fastest treatment possible, be sure to go to an orthodontist. Randy, there are probably a lot of women watching this show right now thinking, gee, I wish my boyfriend would do orthodontic treatment, or I wish my husband would do orthodontic treatment. Most men are brought in by their wives or their girlfriends.
Is that right?
And 40% of orthodontic treatment right now in the United States is being done on men. Okay. This is the typical orthodontic case of a male patient. It's the 45-year-old businessman brought in by his wife or by his girlfriend to get his teeth straightened. So in this case, this gentleman had crooked teeth, a deep bite, and we broadened the arch, we corrected the alignment, we gave him a broad smile, we gave him a bright smile. How early can someone start orthodontic treatment? We talked about it a little bit, but this little girl...
Do you have to wait until all the teeth are permanent,
no,
like your adult teeth?
No, you do not. There are several stages at which you can start orthodontic treatment. The earliest stage would be with the baby teeth. And if there is a functional shift where the jaw moves to one side or the other, as in this case of this little girl who had a crossbite in the posterior, in the back of her teeth, this should be treated as soon as possible, because narrowing of the upper arch not only affects the bite and the shifting of the jaw and the growth of the jaws, but it also affects your nasal passages. And someone with a narrow upper arch
How old is this girl?
4,
like 4 or 5 years?
4 or 5 years old. Not only do the teeth affect your bite, it can affect your breathing, it can affect your sleeping, and ultimately it affects your ability to learn at school if you're tired at school.
Okay.
So arch expansion in young children is very, very important for the correction of sleep apnea.
Is it braces or retainers? Or?
In this case, we did an expander. We don't put braces on baby teeth. We never put braces on baby teeth.
Okay.
We use removable expanders to broaden the arches.
Yeah, looks nice.
Thank you.
And parents, so if they see the teeth not coming together just right, they need to go see.
If they're at their child's 4-year-old birthday party and they see that something is not quite right, that child smiles and they see their jaw going to the side, forward, backwards, they should bring that patient in to see the orthodontist as soon as possible.
Okay, good. I wanted to ask you this question. I know we're almost out of time, but it seems like the lower teeth with older people, it happened to me, they start to shift. Why is that?
The reason is, Randy, that the lower teeth have the smallest contact point between them. And there's a natural biologic process called mesiodrift, where teeth drift to the middle until they touch. If your contact is broken, your teeth continue to shift, and it's in every human being. That's why it's so important, if you've had orthodontic treatment, that you wear your retainers for life. Some adult patients prefer to have permanent retainers, so they don't have to worry about retainers. And it's important to keep your teeth straight.
It seems like when you're older, the lower teeth show the most.
They do, and it's because our lips tend to head south a little bit, and our smiles change as we age. And I think adults are more conscientious of crowded teeth as they get older. What may have not bothered them at age 17, they start looking in the mirror a little closer at age 40. And everyone wants to feel good and look good when they're 40.
We're out of time. Final message. Somebody watching this, they want wider, straighter teeth. I think you said that that's one of the things everybody wants. What do you say to them? But for whatever reason, they're putting it off.
Well, what I would say is, at any age, don't hesitate getting orthodontic treatment. When it comes to straight teeth, braces, retainers, or Invisalign, an orthodontist is the smart choice. And most orthodontists are happy to see new patients. The consultations are usually complimentary. And there's much that can be done to improve your teeth at any age.
You do a lot of Invisalign.
We do a lot of Invisalign.
Are you of the opinion that, if you're going to get Invisalign, might as well go to an orthodontist? Does it cost more to go to an orthodontist to get Invisalign?
No, it does not cost more to go to an orthodontist. And orthodontists are vastly experienced. It's like, how do you get to Carnegie Hall? Okay? I can hand you a violin, but if you don't have the training to learn how to play that instrument, you're not going to get to Carnegie Hall. Orthodontists have had intense study, which has lasted 2 to 3 years, with the best mentors that are out there. Some orthodontists are going to see certain things that others will not see. In my particular case, you've probably picked up that we do a lot of orthodontic surgeries. I'm one of the biggest practices in Northern California. I have patients driving 2.5 hours to my office for orthodontic surgery.
Are you a perfectionist, by the way?
Very much so. Very much so. And our office is focused on clinical excellence, outstanding customer service, and a great patient experience. And we really give it our all. So we hope people will come to see us in Antioch, California.
Great. I want to thank you for coming on the show. Pleasure.
Thanks for having me.
And I did. We practically begged you to get in here for 2 years, so I'm glad you finally made it.
Thanks, Randy.
And if I lived in your area, you'd be my orthodontist.
Thank you. I
thank you
appreciate that very much.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, just go to our website, put in Orthodontist, and you'll find her there. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.